Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we're going to be talking about a very sensitive topic about what is the guarantee that my dental disease will not happen again, and what is the guarantee that my dental treatment will be successful. Let's start. So I get a lot of calls from patients where they ask me two questions. The one question is that I am suffering from this disease or this oral or dental disease such as gingivitis or periodontitis, and they ask me what is the solution, and then they ask me would I get it again. Now I have to give you some context about these things. So when people ask me will my gingivitis or periodontitis go away, I ask them one thing, and they ask me in lieu of getting the dental treatment done in the form of cleaning. And then I ask them this question, that once you get a fever due to an infection, be it a stomach infection or anything, when the fever goes after taking all the medications, is there a guarantee that the fever won't come back because of the same cause or any other cause? So as a human, you are susceptible to infections, and most of the oral health diseases are infectious in nature. They might not be very overtly infectious to give you a fever-like response, but they do have signs such as pain when it comes to dental infection, such as dental decay. At the same time, bleeding gums when it comes to periodontitis, that is your gum disease. So what I would like to say is that we need to start changing our mindset, because see, we are humans. As long as we are not in discomfort, we will end up ignoring the disease, and that's what happens in a lot of cases, right from dental decay to dental infection to any sort of gum disease, till the point there are some palpable symptoms, such as there is a lot of tangible pain that can be very harrowing if it goes to the severe degree when it comes to the treatment where it requires an RCT, or when your teeth start losing its bone support so much that they start becoming mobile, and then it gives you an anxiety attack. Now that's what I'm trying to tell you, that you are susceptible as a host towards diseases. If you're living, as long as you're living, you have a body that is a dynamic nature, definitely there's a chance of recurrences of any sort of disease. Secondly, when people ask me about this success rate of all the treatments that are there, it could be the success rate of an RCT, the success rate of periodontal surgery. See, the literature always talks about the success rates, but you have to understand that there is no such thing as a lifetime guarantee or a lifetime warranty of a disease. So successful dental treatment in dentistry does not mean a lifetime warranty or guarantee. I would strongly recommend that you need to change that notion about the prosthesis, any sort of treatments. But I would like to tell you that when we talk to our peers about it, and also in most of the studies that are carried out in our academia, the success rate is actually kind of measured by the 5 years and the 10 years. So usually the 5-year survival rate of any prosthesis or any sort of implants or any sort of fillings and all those things, if the 5-year survival rate is more than 90%, it is considered academically very good. Otherwise, treatments do last way longer, and sometimes they don't last because of the fact that it could be possible that you have developed complications. You're not a great case selection because of your immunity. You're not a great case because of your parafunctional habits. You might be having a crown placed in an area where you clench, so that could be a possibility. And there are a lot of other things that can be possible because you are a human being and you are susceptible to disease, incidents, trauma, and so many other things. So I would like to reiterate to all of the patients who are actually looking at it, I understand, because dentistry is not reasonably priced. It is expensive, let's be very honest, and it is your hard-earned money. I completely understand, and I'm completely aligned with that thought. So the fact is that because it is not very urgent, I'll give you an example. If you're having a heart attack, unfortunately, God forbid, you will not think about the guarantee of a bypass or the success rate of a stent. At that point of time, you are just thinking about to save someone's life. When we say it's a matter of life and death, right? When it comes to dental infections, especially in their initial stages, because most of them present pretty painless, and that's why we are not anxious about it, and we tend to ignore it to such an extent that it reaches either a terminal stage, such as periodontitis reaching to tooth loss, or any sort of tooth pain or pulpal pain related to either a lot of radiating pain, severe pain, or cellulitis like complications. So my responsibility as a dentist and a medium between the dental fraternity and the patients is to make sure that you are aware of oral health and diseases and the prevalence and the fact that what you need to do, And in most of the cases, all you need to do is call up the dental office and get your treatment done. That's the most important thing, and be regular to your dentist. That's very important. So that's today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to follow me on social media, here are my handles. And if you want to do a WhatsApp consultation, please refrain from calling me directly. You can drop me a message and then I can answer it to you in the text message. At the same time, if you feel like that there are some things that you would want to talk about in the comment section, please feel free to do so in the same. That's it for today. Thank you.